Radiation therapy is now available widely across Australia. There was a time about a decade ago where access was a bit more challenging and centres weren't present in metro and regional areas. But the radiation craft group with the College of Oncology, RANZR, has done a great job in advocating and establishing centres around the country. So access is much better, and almost I'd say the access problem has probably been solved. When it comes to the cost of radiation therapy is available in public and in private hospitals and in private community centres around the country. Generally, a rule of thumb would be that 85% of radiation therapy is covered by Medicare, and so in private centres the out-of-pocket cost is about 15%, which varies depending on whether you're having a short or a long protocol. An important point here is that radiation therapy has never been covered by health insurance. Many patients think that they have health insurance, therefore it will be covered, and that is incorrect. Surgical cancer care and medical oncology or chemotherapies, if you have insurance, is covered. But radiation therapy is considered an outpatient treatment, takes 15 minutes, and so it's not covered by health insurers at this point in time in Australia.